So how exciting to see you guys tonight. We've been looking forward to this evening, to seeing all of you, to seeing all your lovely faces. We're just imagining them right now behind your mask, but it's great to see you guys. Thanks for being part of this tonight. My name is Mark Paris, and I'm with the Charlotte Center for the Humanities and Civic Imagination, the Charlotte Center for short. Our mission is to help people and communities flourish. And by flourish, we mean an all-encompassing flourish, intellectual, emotional, physical, spiritual. We think it's the most important work that we can do to help people live into the fullness of their lives and to become the best versions of themselves. We do that by bringing people together through the lens of the humanities. So philosophy, history, literature, poetry, the arts, which ask certain questions that shift what is possible in our lives. We'll talk more about our programs and our ambitions later tonight, but for now we want to move forward with the forum, and the forum has a certain structure. That structure is connect, consider, and ignite. Connect is an opportunity for you to meet somebody new or to get to know someone you already know a little bit better. We ask that you risk going deep and being real with the person next to you. All great things begin with a conversation. Consider is when we hear from our guest speaker tonight, and I'm thrilled that we're going to hear from Dr. Alison Bickett on the art of medicine. And ignite is when we, again, consider what we've heard and what it might mean for our lives and our community. So before we begin, there are a few people that I need to thank. And I want to begin by thanking the people who make our events and our programming and our mission possible. Our donors, our sponsors, and our partners who believe in what we're doing, who have stepped up, believing in our mission and supporting us. So we're deeply, deeply grateful for them. So we begin our programs with an introduction to the humanities that kind of sets the stage and sets the mood and brings us into a moment. And I'd like to introduce to you a poet who will begin our program tonight. So Elaine C. Hill is a poet and body-based mindfulness coach and mother of 2 children. She has a Master of Arts degree from UNC Charlotte in English linguistics. Her work has shifted from scholarship in the cognitive realms of language to poetic experiences devoted to healing illness and relational upheaval. Elaine is the author of 2 collections, a chapbook entitled 1,000 Small Poems from Early Motherhood, and a full-length collection, Sing Home Back to Me. Her work is forthcoming in Voice Lux and has appeared in On Earth and Sky, Wingless Dreamer, Levy, and Contrary Magazine, and she was a semifinalist for the Francine Ringgold's Award for New Writers. So please help me welcome Elaine to the stage.
Open letter to a doctor after another diagnosis. An epigraph by Emily Dickinson. After great pain, a formal feeling comes. Doctor. Weight presses in my chest. No, it's not a heart attack. It's a formality. How do you do to the landmines of symptoms rumbling all week, hazards waiting to be wreaked? Sure, there's relief when the complaints have a name, but there's also, well, grief. It's time to concentrate on you, you say, but why? Why hold my gaze on body wasting away, caught in a sickness game, a where you gonna hurt today? Chronic means this is my life. I do not want to prescript it away. I'm tired of the words and numbers that explain my current state. When a diagnosis puts a notion in your head, remember the arts belong in medicine. See me instead, a human tapestry painted with this, just another office where my body ricochets from dosages to side effects like earthquakes sway. What's the difference in a war on disease and a war on me? Treatment, a battlefield while my body speaks. I've nearly died so many times. Einstein says only a fool repeats a process expecting a new outcome. Can we listen? I've heard dis-ease means my body communicates its needs, shouts from the pulpit of blood tests and body aches. Maybe the next prescription I need is to re-script my previous lifestyle to lead to the cure that frees me. Healing is as much about being a human soul as it is about the suffering body. Dear doctor, with treatment, refuse the language of body decimated in the name of medicine. I'm tired of being both battlefield and weapon jettisoned. Speak gently as my body endures the fight. Toxins loose in body systems. Instruct me when I hold on too long to old ways of thinking. Walk with me when disease breaks me right before it breaks free. Healing, the greatest transformation. So doc, paint me a picture of what health might be, how recovery can be opened like champagne, bubbly and spouting, how together we can take steps to find parts that are doubting and prescribed me laughter into wholeness with friends. The art is in us, doc. Let us start again to a symphony score, playing to the tune of a broken soul's communion with its body. Hear the melody surface and ebb with the breaths I breathe. It's not the end. Hear the music. Perhaps I will not die from this. Perhaps I will only suffer for a bit. My life canvas taut and thin. Health is configuring my mind to my body as much as it is prescription doling. Wait for another moment, another medicine, another life. I have to live.
Good evening, everybody. We've moved to our segment of the evening around Connect. So I want to pose a few questions and allow you some time to talk amongst yourselves in twos or threes or fours, preferably with a few people you don't know or didn't come with tonight. And then we'll open it up and engage together, kind of share some highlights from your discussion. So 2 questions and 10 minutes. All right, the first question: when in your life have you experienced personal growth? What was it about the times, the circumstances that led to the growth? And how did you grow? I want you to find somebody or 2 people to turn to and share your thoughts. So I'm curious to hear your stories, your experiences, what you were able to share. We have Laura in the back who has a mic. So I want to invite someone to share brief highlights of their story, what their experience has been, and what the circumstances were, and how they grew.
Hi, my name's Howard. I work with Mark for 16 years. So the one that I shared, I was diagnosed with cancer at 7 years old, and that wasn't the growth. That was a lot of poor habits and hiding and pretending I was fine when I wasn't, emotionally and socially. It wasn't until graduate school that I really started recognizing my patterns of hiding and pretending that I was okay, and because I just wanted to fit in and not be different. So in graduate school, I finally had the courage to be vulnerable and authentic with my classmates, my good friends and roommates, and rather than judging me, rather than saying, we don't want to be friends with you, they started self-disclosing. And so that actually became my dissertation topic, which is the therapeutic use of self-disclosure and the impact that that can have on the counseling process. So while the counseling session isn't about the therapist, at key moments, it actually can be quite beneficial for a therapist to share authentically rather than pretend to be the epitome of mental health. So, thank you.
Thanks, Howard.
I am deeply honored, and it truly, I know everybody says this, but it truly gives me pleasure to introduce my colleague, Dr. Allison Bickett. She is the Director of Behavioral Medicine Education at the Atrium Health Family Medicine Residency Program. She's also the Clinical Supervisor of Behavioral Health Integration Program in the Department of Family Medicine. She has faculty appointments at Chapel Hill as a clinical assistant professor, and she's assistant professor of family medicine at Atrium Health. So that's what she does, but what is brilliant about Dr. Bickett is how she does it, and you're in for a treat tonight of just one of the many things she does to bridge this world of mental health and medicine. With that constant positive regard for each of her learners, whether that's medical or mental health, she deeply listens and gently guides them on their path of self-discovery as both a professional and as a human. So what you're about to hear and see is a creative means to deeply contemplate what is happening, not just for the patient, but for the clinician as well, and the interface between them in their relationship. Dr. Bickett.
I barely know how to speak after one of my absolute mentors in my life gave me that kind of introduction. Thank you very much for your gift of words, Dr. Waxman. I appreciate that. So it is my absolute pleasure to be with you tonight as part of this great collaboration between the Beckler Museum of Modern Art and Atrium Health. And we're going to be talking about a program that has been one of the most soul-filling activities of my professional career thus far. And we're going to do a deep dive into the elements of the Art of Medicine program later on, but I want to stick first with that question that you were all asked, which is, tell me about a time in your life when you experienced the most growth, and what was it about that time that was most impactful, most meaningful? That time, for me, is associated with a place. And that place is Jyväskylä, Finland. Jyväskylä, Finland. So close to Jyväskylä, Finland is about 4 hours north of Helsinki, if you're traveling by train, smack dab in the middle of the country. And it's in a region of Finland that has maybe more lakes than land. It's gorgeous. And I ended up in Jyväskylä because I went to grad school there for neuropsychology. And I got there because somehow I found this brochure, and the Department of Psychology at the University of Jyväskylä was advertising courageously this bright, shiny new lab that they were putting together, and they were giving grad students access to it with fMRIs and EEGs and all sorts of fun stuff. And I was like, there you go, I'm taking that bait. So that's what ended me up over there, but I knew I needed to spread my wings across the pond and find out what life was like outside of North Carolina. So, Jyväskylä, Finland, that's where I ended up. I did miss the memo that you're actually able to study abroad during warm summer months in like Italy and Spain and France. Usually you have one of your best college buddies with you and you do some light curriculum like studying the language. Didn't get that memo. Also, I've never done anything the easy way ever in my entire life, and my family and my husband will vouch for that. So I go to the North Pole by myself in January to study neuroscience. Y'all, I stepped off that plane in this long, cream-colored, pretty thin coat from Banana Republic. And I was 150% underpowered for the climate at hand, 150%. It made no sense. But I had this image of myself like gliding through the snowdrifts romantically in my long white coat. Oh, it didn't happen. I had to call my mom like after 2 weeks and ask for a bus pass so I wouldn't freeze to death on the way to school, and I was too poor to buy a parka with a goose down feather in it. So me and that white coat had some great adventures together, though. I saw the Northern Lights. It was in March. I didn't think I was going to get to see them. And I was walking by myself, and I turned the corner, and I'm in the middle of this field. And the green and white swirls were all about the heavens. And I just thought, nothing is ever going to top this. So I saw the Northern Lights. I participated in an ice swimming competition. I went to the North Pole over weekend trips, Rovaniemi, the Laplands. I sat on Santa's lap, like the Santa's lap. I got clout with my 7-year-old daughter, Clara. And I saunted every day. I tutored a Finnish woman, and I had a good time. I did use that EEG machine, by the way. I studied P300 waves and sustained attention. So there, checked an educational bucket list thing off of my list. So I didn't go over there in vain, Mom. So those are cool, pun intended, experiences, but what about that time was actually meaningful for me? What made it the time in my life when I experienced the most personal growth? What was different? And I asked that question to my patients a great deal. And it's part of a technique that's used in solution-focused therapy. In solution-focused therapy, you're not focused on the pathology or on the problem. You're focused instead on the solution. You're illuminating the exception. So tell me about a time in your life when you weren't depressed, when you weren't anxious, when you weren't experiencing interpersonal turmoil with another human. Tell me about that time. Tell me about when you experienced the most growth, and then what was different about that time. And within the exception, sometimes a solution can be forged. So, what was different about my time in Finland? I got 3 things. Number 1, I was obviously entirely outside of my comfort zone. Nothing that I knew was true in life was the same when I was in Finland. I had a new way of doing school, new culture, new people around me, new everything, new location, new climate. Everything was different. But here's the thing about novel experiences. Sometimes novel experiences, among other things, can actually induce the release of dopamine. And dopamine is a very neat neurotransmitter that does a whole lot of stuff, including, but not limited to, can increase memory and concentration. It can boost your mood. It has this pro-social impact whereby it makes you more receptive to engaging in meaningful connection with other people. So on a physiological level, perhaps some of my growth came from having these novel experiences, putting myself out there. The second thing that was different about that time is that there was a whole lot less noise and a whole lot fewer distractions. I had no TV, no radio, no cell phone. I had spotty internet connection through dial-up. I was a very late adopter through email, so I wasn't communicating that way. So I never watched TV that much before Finland, but I did listen to a lot of music. I always had something on in the background, like drowning out my thoughts. And I always had people who were like a phone call away. And here I was at the mercy of international calling cards, which were exorbitantly expensive. So I wasn't talking to my people. I didn't have the people to soothe me, to soothe my mind. And so that first month, especially when I had not made a lot of friends yet in Finland, that silence was deafening. And for me, it was pretty terrifying. Because for most of my life, I have struggled significantly with anxiety and depression, usually both at the same time. And so noise and distractions for me were my emotional security blanket to drown out the sound of my own brain. I was never comfortable in my own brain, you know? Maybe it sounds like there are some wounded healers out there too. I call myself a wounded healer. I think it's a superpower, you know, a little bit, because when you have the experience of a mental health issue or the experience of going through trauma or the experience of dealing with an addiction and fighting through that, you can connect with other people on a much different level, and it can really facilitate the process of healing in a different way, you know? So shout out to the wounded healers. So I would love to tell you that, like, after 2 weeks of less noise, less distractions, more sitting with my own brain, that I was like, I got this, now I'm comfortable in silence, and I'm healing a relationship with myself, and that was not the case. It's still not necessarily the case. It's taken a lifelong journey of intentionally turning down the volume on the noise and the distractions so that I can sit with myself. But it's, you know, it's hard. It's an ongoing process. It truly is. But Finland was the place where I learned that I could be still and silent, and that silence was, although unbearably painful at times, it was bearable, and I could manage it. And I think I needed to know that on some level. And then once I turned down the volume on the noise and the distractions, it really made me better able to pay attention to myself and to my senses and to the people around me, to the environment. I could notice, I could open my mind to new perspectives. And so that was the third thing that really made this time different for me, is that I gained perspectives. So ultimately, I did cultivate some meaningful relationships with people in Finland. I made some friends, and they were brilliant minds from all over the world. And I'm embarrassed to tell you, but I'll tell you anyway, since we're being open and honest around here, that I was a privileged white American girl coming in hot with my opinions. I didn't stay silent very often. And so then I get in this group of people who know a whole lot more about the world than I do on every subject matter. And so it did me well to turn down my noise and distractions and get silent and listen up, because I had a lot to learn. And I grew tremendously when I was able to slow my roll and gain some perspectives from these other humans whose lens was so beautifully different than mine. So that's Finland. What in the world does that have to do with the Art of Medicine program that you came to hear about this evening? And I'll tell you, I've spent a lot of time thinking about what might make this Art of Medicine program worthwhile, engaging, powerful, different. And the things that facilitated my time of growth in Finland are some of the same concepts that are embedded in our Art of Medicine program here. So number one, we're getting healthcare professionals out of their comfort zone in a geographical location, one, so we're getting them out from their hospitals and their clinics and into this beautiful museum here, because this is where we hold our sessions. So that's one, but we're not only getting them into a novel location, we're also asking them to think entirely differently. Now, I haven't given you all of the elements of what our Art of Medicine program is quite yet, but I will do so a little bit later on. But just know that everything involved in this Art of Medicine session involves, number one, embracing ambiguity and being able to tolerate that ambiguity and gaining different perspectives, being able to hypothesize wildly and imagining, and also explicitly exploring your emotional content. So, y'all want to really mess with the physician, ask them a question, and then tell them there's not a right or wrong answer. Does not compute. Physicians are programmed to be right. They want to know the answer. Ambiguity, not fun. They don't get it. So it's very hard for them to go to this prescriptive world, into this world of ambiguity, so that we are asking them to think differently. So that's one thing. But like healthcare providers, just like any of us in a lot of different professions, we're operating in this world that is algorithmic and standardized and protocolized, and a lot of that is very good. A lot of our protocols in healthcare were developed for the interest of patient safety. That's good, you know? I bet a lot of you are pretty glad that we have some if-then statements around your healthcare. But when you constantly operate in a world of if-then statements and you're not able to practice necessarily the way that you'd like to practice, you have reduced autonomy, that can wear on your soul a little bit. That can decrease creativity, can decrease cognitive flexibility, and it can stymie what we might refer to as the art of medicine. So this program is an opportunity to get them out of their comfort zone and reconnected with the art of medicine. The second thing that I think is a big component of the Art of Medicine program is that we do try our best to reduce the noise and distraction. No cell phones, no competing demands. You're just in a dark and quiet museum that's shut down just for you, so your whole job is just to focus on the art in front of you and the feelings you're feeling. Third thing, gaining perspectives. The entire crux of our art analysis techniques and of our emotional processing components to the Art of Medicine program require that we are hypothesizing and imagining, and most importantly, listening to one another's perspectives to develop this shared pool of meaning that has all of the voices present. And then beyond those three elements is my favorite critical element that makes this program powerful, and that is the focus on the art. Dating back to ancient civilizations, arts and humanities have been absolutely integral to the practice of medicine. Apollo was not only the god of healing and disease, he was also the god of music and poetry and dance and truth and prophecy. And it was to Apollo that Hippocrates dedicated his oath that reminds us that there is art to medicine as well as science, and that warmth and empathy and understanding may even outweigh the surgeon's knife and the chemist's drug. And all of you know that in the 20th century, there was a rising predominance of science and technology in medicine and in medical education. Abraham Flexner's 1910 very influential report called for a more rigorous scientific base for medicine. Not a bad thing. Practically, this brought about evidence-informed decision-making and teaching and assessment, and once again, I bet a lot of you all are happy that we have those things in your medical care. It also may have brought about the biomedical model, which has tended to eliminate the heart and the mind in some ways from the body, but still, many notable physicians have upheld the essential need for interweaving the humanities into medical practice and in medical education. William Osler, Canadian physician and one of 4 founding professors in Johns Hopkins Hospital, said, "Medicine is an old art that must be absorbed into a new science." So maybe we can start to begin to understand that the humanities and scientific rigor don't necessarily need to be mutually exclusive, right? Your poetry outlined that in a way that our words never could. And I want to say something else about the arts and humanities as a healing tool. I work with more individuals who have experienced trauma and abuse and neglect and exploitation than I ever imagined that I would. The prevalence rates are so high. And in fact, many of you have probably experienced a traumatic event in your past, but certainly in the past year and a half, you've experienced trauma on some level. And when I work with patients, so frequently I find that they can't find the words to describe their traumatic event or the emotions related to it. They feel it. It comes out in their somatic symptoms, in gastrointestinal issues, and in headaches, and in chronic pain, but they can't say the words to talk about what they've experienced. What's that all about? Bessel van der Kolk is a neuropsychiatrist, and he wrote the book on, it's called The Body Keeps the Score, which I would highly recommend to anyone. But van der Kolk has devoted really his life's work to understanding and treating trauma. And what his research has found is that when we are experiencing a significant seismic threat, our brain and our body go into survival mode to just try to keep us safe, right? And one of the first things that shuts down is our neocortex, which houses some of our language center, and that's partially shut down. So when I am trying to engage in psychotherapy, trying to get my patient to talk to me about what they have experienced and to use words to describe their trauma, they can't. And van der Kolk calls this forcing language on the experience of trauma the tyranny of language. You know? And it makes sense to me. So how do we help these humans heal who have these deep, deep wounds and have experienced this deep, deep trauma? And one of those ways can be through art and sculpture and dancing and music, whether you're creating it or whether you're looking at it or experiencing it. The art can be the way around. So that's why this program is important. So I'm going to describe the infrastructure of our program in just a moment, but I would like to direct your attention first to the screen. This is a live action shot of our Art of Medicine program. This was on the 4th floor of the museum when we had this fantastic exhibit going on called Nomadic Murals, Tapestries of a Modern Era. And I never thought I would be jazzed about tapestries, to be real honest with you, but y'all, this exhibit exceeded all my expectations. So it's paintings by Moreau and Picasso and Giacometti and Lichtenstein that are embedded in these tapestries, and it was so powerful. The one you're looking at right here is a Lichtenstein, real Lichtenstein. So what happens during our program? Well, normally I'm going to start with participants. We have between 10 and 15 participants join us in the museum. And those participants have been med students, residents, fellows, attending physicians. We started bringing in APPs, which are advanced practice providers, nurse practitioners, and physician assistants. And we've got, yeah, right? And we have had people from almost every department in the hospital. We've got neurologists, we have trauma surgeons, we have OB, we've got family medicine, we've got internal medicine, we've got urgent care. They've come from everywhere. Y'all, this diversity is so rich. So when we get all these people in a room together, and we're not doing like department by department, we're throwing all those people together in one little pot and stirring it around, which is so good. So those are who are in this program. And like I said before, we have the museum shut down just for us. Our participants are invited to come in at 6 o'clock, and we have the first 30 minutes as a time for fellowship and connection. We give them some wine, give you some cheese, give you your charcuterie, connect with your fellow colleagues, and leave the world from whence you came behind for a minute. Center yourself. And so after we have that moment of centering and connection, then we give the physicians the opportunity to go upstairs to the galleries led by one of our brilliant colleagues at the Beckler. It's usually a docent, or in the past it's been one of the executive directors, and he leads us through this art, he or she leads us through an art analysis exercise called visual thinking strategies. Typically they pre-pick like 2 or 3 works of art, and we spend about 45 minutes going from artwork to artwork. So, like I said, this method is called visual thinking strategies, and it was developed in the 1990s by Dr. Abigail Hausen, who is a cognitive psychologist, and Philip Yenawine, who is a veteran museum educator. And so together they partnered with the Museum of Modern Art in New York City to develop and disseminate this really incredible curriculum around visual thinking strategies. So what it is a way of facilitating interaction with the works of art using this collaborative and perspective-taking dialogue within a group of people. It was actually developed for school-age kids who were at the museum for the field trip. So that's who it was developed for. It was to give them a way to meaningfully interact with the art. And that reason why it's meaningful interaction is because you don't have some docent up there telling you who the artist is and what the narrative is about the piece of artwork. You allow the group to look at the artwork and then decide how they're experiencing the art. So it's an entirely different way, a novel way, of looking at art and experiencing art. It's just 3 questions. They seem so simple, and they are so profound. So it's, what do you see in this painting? What's happening in this painting? What makes you say that? And what else can we find? And the questions build upon each other, and they are totally contingent upon the group members and what kind of emotions and what kind of health beliefs and what kind of thought processes and circumstances they're bringing to that group in this moment. That's what makes it so special. My co-facilitator, Dr. Mary Hall, and I have listened to groups unpack the same piece of artwork so many times, and we are floored every time by how different the perspectives are. It's fantastic. So there's a growing body of literature that highlights the benefits of VTS in medical training and education. A lot of top-tier medical schools, including but not limited to Harvard, have started incorporating elements of VTS into their curriculum. And what we're finding, even though the research is in pretty nascent stages of development, is that VTS appears to, number 1, improve listening skills, because we're asking participants to respectively and actively listen to their colleagues' viewpoints and accept different perspectives, even when those perspectives are different from your own. And not only that, we're asking our participants to build upon those perspectives that are different from your own. Number 2, the VTS process also appears to increase analytical thinking because we're asking our participants to decode the meaning from the images seen in the paintings, to look for metaphors within the artwork. And finally, and I think really amazingly, there are some studies that have found that participants have improved physical examination skills and enhanced accuracy in the assessments of imaging. So like an MRI or a CAT scan, because they are practicing taking their time in front of an image to notice the intricate details. So just those 3 seemingly simple questions unleashing all of this potential. But when you practice it, the spirit of VTS can really change the way that we relate to one another as humans, as teachers, as students. And I'm going to point out that Thanksgiving is right around the corner, and you may find yourself at a table with a family member or a friend who may have some differing views from your own, especially around polarizing issues. Can you imagine yourself using these 3 questions to give you some space in one such conversation? So I wonder what Uncle John means when he says this. What can I find in his diatribe? What makes me think that? What else can I find? See how much nicer that is? So, VTS is really cool. And then we have our participants come downstairs to the 2nd floor, which is almost like a classroom setting, and our chairs are in a circle so we can all see each other. And I give them 3 minutes to reflect on 2 questions. The first question is, what emotions were elicited from the artwork? And the second question is, what patient were you reminded of when you were viewing that art? These questions are meant to serve as a bridge and also an invitation for the artwork to follow the group down to the classroom and be embedded in this next part of our session, which is the Ballant Group. So the Ballant Group is a place for reflection on patient-physician interactions that leave us feeling a lot of feelings. Because caregivers and healers and physicians and nurses and APPs, we're not robots, are we? And neither are patients. So we're all coming to the healthcare setting, to this room where the physician and the patient meet with our own set of health beliefs, with our own set of biases, with our own set of emotions and personal circumstances. And sometimes when those 2 meet, it can be beautiful and it can be engaging. And sometimes when the 2 of those meet, for the patient and the physician, it can be complex and really challenging. And Ballant groups are one way to help understand the relationships between patients and physicians. So Ballant groups are named after Michael Ballant. He was born in Budapest in the late 1800s, son of a general practitioner, which is like a PCP over here. And as was done in those days, he was kind of living in this apprenticeship model and was expected to become a physician like his father, so pre-HIPAA, of course. He joined his father as his father was seeing patients. And he became really fascinated with the relationship between the physician and the patient. He actually ended up not practicing medicine. He studied psychoanalysis under Freud and colleagues, actually, but he never lost this drive to better understand that physician-patient relationship. And so he created these groups for physicians that he tried to help them appreciate the psychology of practice, to listen a little bit better and try to understand the patient a little bit better, and to understand how their own thoughts and emotions were perhaps even linked to patient outcomes, and they are. You know, the vibe of the physician can 100% change the health outcome for a patient. Again, thank you for the poetry that you shared with us, because I think that brilliantly illustrated that. For better, for worse. But he came at it from a positive stance. He coined this term doctor as drug, because he really believed that when the doctor does listen, when the doctor is vulnerable, when they do open themselves up to a real conversation with the patient, that can be the most healing thing about that interaction, about your health care. That can be the thing that makes the difference for the patient. So I want to mention, too, that I keep saying physicians. Ballant groups are not exclusively for physicians. I think any healthcare team member will absolutely benefit from being a part of a Ballant group and exploring these emotions. Teachers and pastors are starting to explore use of Ballant groups. This is weird, but I'm open to it. Veterinarians are starting to use Ballant groups. We've got a whole group of veterinarians joining us for our national conference in January, so I'll report back on what that's all about. But just briefly on the structure, we have one physician present one case that has really been evoking some strong emotions in them. Maybe they can't stand the patient, and when they have their hand on the door to walk in the room to see the patient, they have like this visceral reaction. Maybe the patient reminds them of a relationship with a loved one, and they've become so mired in this relationship that they can't see the patient clearly or objectively anymore. It's the patient that keeps you up at night. It's the patient that stays with you. Those are the patients that you're supposed to present. And so one physician presents one patient, and then ultimately the group has the opportunity to take the case from that patient. The presenter has the luxury and the opportunity to give this burden to the group and to no longer participate in it, and then the group takes the case and imagines what it's like for the physician, what it's like for the patient, and what happens when they get in the room together. We bring the presenter back in with 5 minutes left, and they can say something if they want to. They don't have to if they don't. And then we end on time. And the reality is that usually the group ends not tied up in a neat little bow for the presenter, not with an answer or a solution necessarily. But usually the feedback that we get from presenters is that there has been some kind of shift in some maybe imperceptible way. That the next time they engage with that patient, things are a little bit different, even though they can't put their finger on why. Maybe they saw the patient differently. Maybe they heard the patient differently. Maybe they saw the physician role differently. But it's a shift. So as you may have picked up on, there are a lot of similarities between VTS and Ballant groups. Did you guys notice that? A lot of the same vibe. I want to take an opportunity to talk about the first two people who noticed that there were similarities between VTS and Ballant, and that's Dr. Lisa Howley, previously with Atrium Health. She's now the fancy Senior Director of Strategic Initiatives with the Association of American Medical Colleges, and the other person is Christopher Lawing, who is a former executive director from the Beckler Museum of Modern Art, both very special people. So as rumor has it, they were at an event together, and Christopher was passionately explaining VTS to Lisa, as he did. And Lisa recognized, because she is friends with Dr. Mary Hall, who is the Senior Vice President and Medical Education Chief Academic Officer with Atrium Health, She co-facilitates Ballant groups with me for our residency program once a month, and she has a passion for Ballant that is unparalleled. If you've met Mary for more than 5 minutes, she's talking about Ballant. So Lisa knew Ballant from conversations with her, and Lisa said, hey, this sounds really similar. Maybe we should forge a relationship. Maybe there's a collaboration here. So the connection was made, and that relationship between this hospital system and this museum was forged. And I just want to say that Christopher Long was absolutely integral in the conceptualization and the execution of this program. And Christopher Long had a passion for the arts and an insight that has been unparalleled. He used to lead the VTS groups with us, and he really wanted to bring the art into the community. And he lost a tremendous battle with cancer this past June 2020, actually. And I just want to say out loud in this space that for me will always belong to Christopher, that he has been an integral part of this program, and his legacy will live on through this collaboration. So in a moment, we're going to have a chance to experience visual thinking strategies for ourselves. But before we get to the art, I want to highlight a quote about the Art of Medicine program that really just, it's not about VTS or Ballant or the Art of Medicine, but for me, it highlights the exceptionality of all of those. The quote is from Brian Rutenberg, and he is a Southern landscape artist from Myrtle Beach, South Carolina, and now he's living in New York City doing his thing, and he's real famous. And while he was not explicitly referring to BTS, he said this: how does a two-dimensional surface smeared with fat all over suggest light where there is darkness and space where there's flatness? It's very similar to magic in a way, because in magic, what you see and what you know to be true are in violent collision with one another. And I like that idea of two things colliding. A work of art, especially a painting, is a visceral and an intellectual smashing into each other, creating a third thing. Rutenberg refers to this third thing, a kind of mutual creation process that happens when a viewer interacts deeply with an artwork. The painting always comes down to the third thing. There's you, and then there's that, and together you manufacture that third thing. So, we are going to shift into a moment where we have the opportunity to engage in a little bit of VTS. I'm not trained in VTS, but Christopher Long told me that I could do it in presentations, so I'll do whatever Christopher Long tells me. So I'm going to shift to this painting, but I want everybody to take a moment to just take a deep breath and ground yourself where you are right now. Maybe close your eyes as you breathe in, 2, 3, and breathe out. 2, 3, 4. Breathe in, 1, 2, and out, 2, 3, 4. Open your eyes, lift your gaze, and appreciate the space that we're in right now. I wish we had the painting closer to us so that you could truly interact with it, but here it is. You can move around the room if you want to, come around the side here, and take a closer look if you'd like to. But I'd like to invite you to consider words that come to mind when you're viewing this painting. So thank you all very much for your time and energy today.